Hello everyone and welcome to my channel. This is Dr. Tidman. Thank you for taking some time to view this brief research review video. This presentation will outline my interpretation of the elements, study design, and results of the study I'm reviewing. I've also posted the original article for you to review in the description below. Please remember to subscribe to my channel and like and hit the notification bell so you'll be informed of my future video postings. And remember that these videos are for informational and educational purposes only. Please consult your own medical team if you'd like to make any changes. For those of you who have not watched my channel, my background is I'm a metabolic health practitioner, a professor, and the director of clinical research for the Colorado Parkinson Foundation. Since 2018, I have been conducting clinical research in Parkinson's disease. Some of my former video presentations are available on my channel, so check them out. Also, comment if you find the videos helpful, educational, or you have some questions. I also will be posting future videos on topics like metabolic health, metabolic syndrome, insulin resistance, bone health, diabetes, so stay tuned. I typically post new videos every Monday. Today I'll be reviewing a research study entitled Nutritional Ketosis in Parkinson's Disease, a review of remaining questions and insights by Choi et al. In 2021. As a metabolic health practitioner, my focus always is to also post some tips and takeaways, things that you could try at home. So stay tuned through the video and you'll see my recommendations and suggestions later on. Now on to our study. So the objectives today are to first review the elements of the study design, the variables and the topic, discuss the author's findings, and then finally to relate the findings of the study to some practical tips for real life. The authors reviewed research pertaining to ketogenic diets, the use of exogenous ketones, which is ketone supplements, and fasting. So all three of these things elevate blood ketones, and you've heard me talk about ketones in other research that I've posted on my channel. They reviewed clinical studies and theoretical review papers. Their intent was to investigate the therapeutic mechanisms from direct ketone body signaling that your body creates on its own and the effects of ketones that you consume. They hypothesized that nutritional ketosis, which is the state that you achieve when you elevate ketones in your bloodstream, has tremendous promise for treating symptoms in Parkinson's disease. And I, of course, as a clinical researcher in Parkinson's, have tested this in my studies, and I completely agree with their finding. The power of ketones. Nutritional ketosis has gained quite a bit of attention in research over the last 100 years for its potential to use a neuroprotective result in neurodegenerative diseases and epilepsy. Ketone metabolism is being tested in Alzheimer's disease as well. So clinical research studies have shown that if you increase your blood ketones, that your brain will increase its neural network, it will improve neuron connectivity, and improve cognitive function. These results have been applied in Parkinson's and in Alzheimer's. We know that the production of blood ketones helps supply brain ATP. And ATP is an element that is reflective of energy production in the brain. The presence of ketones also increases something called synaptogenesis. Synapses are those gaps between neurons, and we want to increase the number of synaptic connections, which improves, again, conductivity of electrical impulses and neurochemical impulses in the brain. They found that new synapses are formed as a direct result of sufficient ketosis, or the elevation of blood ketones, which in my last review you learned that ketones have a protective effect, but they also have the effect to create and sustain myelin, which is the covering that is used in neurons and axons to produce improved electrical impulse connectivity and transmission. So Krikorian et al. Found that there was improved short-term memory and verbal fluency with a low-carbohydrate diet group compared to a high-carbohydrate diet group. They didn't find in their study any differences in motor scores between the two groups. On my channel, I posted a review of Dr. Matt Phillips' 2019 randomized control clinical trial in Parkinson's, and he found that the ketogenic diet group improved their non-motor symptoms to a greater degree than those in the low-fat group. Choi et al. Discussed some studies that found that elevation of blood ketones really reduces symptoms of urinary frequency and urgency that can be seen in many patients with Parkinson's. They also found that the elevation of blood ketones can reduce pain, improve mood, improve verbal fluency and word recall, and they've cited some of these studies in mild cognitive impairment in patients who also have Parkinson's disease. They reviewed studies that suggested that ketones and the use of the ketogenic diet as a therapeutic tool can augment the stability and preserve your brain networks that are needed in cognitive function. They targeted and reviewed certain studies that researched the effects of ketone bodies in clinical trials to slow the progression of Parkinson's disease in animal and mouse models. They also discussed that fasting elevates blood ketones and increases something called autophagy. And autophagy is when the cells that are damaged are cleaned up or cleared out. And you need this to be happening all the time. You don't want to collect a bunch of damaged or malfunctioning cells. You want to have them cleaned out. So fasting actually promotes this. In essence, and Dr. Matt Phillips has reviewed this in some of his research videos on his channel, Human beings have never been created or designed to eat 3 meals a day and 2 snacks. Human beings have been fasting intermittently for generations. We've certainly lost our ability to fast effectively. Choi et al. Also discussed the fact that exercise also enhances nutritional ketosis levels, and they studied these effects in a group with mild Alzheimer's disease. They discussed that the mechanisms involved in fasting are related to switching from a carbohydrate fuel burning preference to a fat burning preference. And sometimes this process that we call keto adaptation or fat adaptation can take some time in some individuals. Choi et al. Discussed that growth hormone signaling is increased by fasting, and this may offer some benefits to the metabolic health and the switch to more fat burning in your mitochondria. They discussed that fasting and ketogenic diets and elevated blood ketones also promotes insulin sensitivity and can be beneficial in terms of memory, mood, and some other cognitive processes. Stephen Cunane's work in Canada has identified improvements in response speed and executive function, that's that higher critical thinking in the brain, with the elevation of blood ketones. They discuss that increased ketones leads to increased butyrate levels in the stool content, which really points to benefits to the gut microbiome and the composition of microbiota. Some studies have pointed to the elevation of blood ketones in producing more of a steady state of dopamine availability. And boy, in Parkinson's, that would be a desirable thing. They also found and discussed some studies that showed that the elevation of blood ketones can help repair the gut lining, especially for those individuals who not only have Parkinson's, but they also have symptoms of leaky gut or bacterial overgrowth in some of the harmful bacteria in the gut. So it's looking like they're finding many studies that discuss a wide variety of benefits for elevation of blood ketones. So, to review, there were some findings in the studies they reviewed of improved memory, but not as much in the studies they reviewed with improvements in motor scores. They did see in some studies that instances of bradykinesia and rigidity did tend to show some improvement with elevation of blood ketones. They reviewed a lot of studies that indicated that ketone bodies are a more efficient fuel source than glucose, especially in the brain, and that ketones can help produce an increased production of ATP, which is an energy molecule available to your cells. They reviewed studies that reported improved metabolic markers like reduced blood sugar, reduced insulin resistance, improved blood pressure, reduced weight, improvements in fatty liver disease, as well as improvements in pain and urinary frequency. We know that chronic elevated blood glucose and insulin levels are related to chronic disease and whole body inflammation. So the results that the researchers Choi et al. Discussed were that studies show that a ketogenic diet and the presence of nutritional ketosis, which is an elevation in blood ketones, have positive neurometabolic effects and can really be consistently used in neurodegenerative diseases like Alzheimer's and Parkinson's. To review, they found studies that reported improved learning and memory, increased brain-derived neurotrophic factor, which is something that the brain needs for function. They found increased synaptic production and integrity of synapses in the brain. They found some network stabilizing effects of elevated blood ketones, improved insulin signaling in the brain, and improvements in mood, mobility, executive functioning, pain, tremor, rigidity, and urinary frequency in Parkinson's disease. So what are Dr. Tidman's tips and takeaways? If you've seen any of my research reviews, these are going to sound pretty familiar. Adopt a medical, nutritional, ketogenic diet. I say medical because this is not the keto diet that you see discussed in social media. This is a therapeutic ketogenic diet used in epilepsy for over 100 years and something we're using widely in neurodegenerative diseases. So this type of diet has between 60 and 70% of your calories each day consumed from fat sources, 20 to 25% consumed for protein sources, and less than 5% of your daily calories consumed from complex carbohydrates. Complex carbohydrates are very low glycemic. In other words, they have a very low impact on your blood glucose levels. And these are things like leafy greens and salads and any green beans, broccoli, asparagus, those kinds of things. I also recommend that you add daily MCT or coconut oil between 3 and 5 tablespoons per day. Now, why is this important? Because this converts very quickly to blood ketones, which are then transmitted across the blood-brain barrier. It's a very simple way to elevate your blood ketones. Of course, you'd need to build up on these gradually. I always recommend for all of my patients, regardless of the diagnosis they're dealing with, that they test their blood glucose and ketones every morning before their first meal. For those with Parkinson's and other neurodegenerative diseases, I'd like for you to achieve nutritional ketosis, which is above 0.5 millimolars, but I also would encourage you to keep increasing your intake of fats and MCT oil to get those ketones elevated to above 1.0 millimolar. This can be achieved also by implementing intermittent fasting regimens, which include a 2-meal-a-day plan, which could be a 16 hours fasted with an 8-hour eating window, or a 1-meal-a-day plan, which is a 20 to 23 hours fasted with a 1-meal-a-day plan. I also would encourage you to exercise 3 to 5 times per week, which would be a combination of aerobic and resistance training. And you'll want to address your gut microbiome with the use of certain probiotics and fermented foods. If you'd like to learn more about the gut and probiotics, check out my YouTube channel where I have a video entitled Probiotics and the Gut Microbiome, And I even show you how to make homemade probiotic fermented dairy. This is the reference for the Choi et al. Article, and I will post a link to this article in the description so you can review this research yourself. Thank you for stopping by to watch my current research review. If you have any questions or comments, please email me at melanietidman@gmail.com. If you're interested in participating in one of my Parkinson's research studies, you can email me at study@coparkinson.org. Remember to subscribe to my channel and hit the like and notification buttons so that you'll be informed of my future research study postings. Thanks again, everyone, and I'll see you in the next video.